a woman, 38 years old. Chief complaints and history. More than 10 days after childbirth, the patient consumed a large amount of cold and raw food and fruits. The very next day, she felt cold and painful in her lower abdomen, defined as the area below the navel. Her condition subsequently worsened, and her menstrual period had not returned for 3 years. Current symptoms, initial consultation. Her current symptoms were her complexion was pale and swollen, edematous. Her limbs were cold, not warm. Her lower abdomen was cold and painful. She felt fatigued and lacked strength. She had blurred vision, and any slight activity caused shortness of breath and unimpeded airflow. She also reported chest tightness, nausea, poor appetite, unformed stools, and copious leukorrhea, white discharge. Her lips and tongue were pale red, and her pulse was deep and tight. Diagnosis and treatment principle. The doctor believed the patient's condition was caused by consuming too many cold and raw foods after childbirth, which led to the blood being invaded by cold. This cold blood flow was obstructed, forming blood stasis. The stasis stagnated in the Chōng Mài, and Rèn Mài, blocking the Bāo Mài, which resulted in the absence of menstruation. The treatment should focus on warming the Chōng Mài, Rèn Mài, and Bāo Mài, expelling cold, enriching the blood, and promoting the smooth flow of qi. The physician prescribed a formula based on Wēn Jīng Tāng. Prescription. The prescription was Chinese Angelica tail, Dongui sen, 15 grams. Sichuan Loveji rhizome, Chuang Xiong, 9 grams. White peony root, Bai Shao, stir-fried, 9 grams. Donkey hide gelatin, Yi Xiao, 12 grams. Cotinopsis root, Dong Shen, 9 grams. Processed panilia, Jiang Bon Xia, 6 grams. Cyperus rhizome, Xiang Fu, stir-fried, 9 grams. Mutin bark, Don Pi, 9 grams. Cinnamon bark, Gui Sin, 3 grams. Avodia fruit, Wuju Yu, stir-fried, 9 grams. Dry processed ginger, Bao Jiang, 6 grams. And licorice root, Gan Cao, 3 grams. This was 1 day's dose. The herbs were mixed and boiled into a decoction. The decoction was consumed twice daily. The doctor prescribed a total of 4 days of medicine. Outcome. Second consultation. After taking the 4 doses of medicine, the patient's appetite increased, and the symptoms of coldness and pain in the lower abdomen and cold limbs were completely eliminated. All other symptoms were also reduced. The doctor then prescribed another 4 days of the same medicine. After the patient finished all the medicine, the illness was completely resolved. Notes for the audience. 1. Chōng Mài, a TCM term located on the front of the body, and it is the body's deepest central trunk line. It goes up to the head and down to the feet, running through the entire body, and is responsible for the storage and transportation of substances and energy in the human body. 2. Rèn Mài, located on the front of the body, is the channel specialized in coordinating and managing all substance pathways that nourish the body. It is directly responsible for reproduction and pregnancy. 3. Bāo Gong, a TCM term. This is the woman's core base for nurturing life. It refers to the uterus where all essential substance gathers, stores, transforms, and nourishes. 4. Bāo Mài, a TCM term. This is the exclusive, dedicated connection between the uterus and the heart and kidney systems. It ensures the most precious life energy is accurately delivered. Note, these channels and organs are not independent. They are interconnected. 5. Qi, a term in traditional Chinese medicine referring to an extremely minute substance in the human body that is highly vital and operates incessantly. It includes the qi of breathing. Qi promotes and stimulates various physiological activities in the human body, including metabolism. The cessation of qi movement signifies the end of life. Some substances in the human body are constantly present, yet invisible, and even exist only when the human body is alive, such as the qi of breathing.